Earlier this week, we shared some of the impact of the ASH Minority Recruitment Initiative programs over the past 2 decades. ASH also hosts the Promoting Minorities in Hematology reception and sponsors the MRI Luncheon to provide minority hematologists and trainees with networking opportunities at the annual meeting.
Cool thing about the reception is there's so many different topics, so it's really spotlighting the amazing research that awardees have been able to do. People who are first and second year medical students to residents to junior faculty. And so regardless of what your clinical or scientific interest is, there's something for you. If you are a sickle cell researcher, or if you're a clinician in malignant hematology, if you do clotting disorders, there will be something there for you. I look around and I see how many underrepresented minority physicians and scientists we have been able to bring into our fold, helping people understand this is a career choice even as a medical student, when a lot of times people don't even know what hematology is as a medical student. So literally being able to give grants that help protect time for young researchers to be able to build a career. And I think the mentorship is key. You're surrounded by people who understand that sometimes pathways are a little bit different, and sometimes challenges for different people can threaten a career. So the Minority Recruitment Initiative puts all of us in the same room, in the same spaces, being able to celebrate each other, celebrate our diversity, celebrate our intersectionality, and it's just so impactful.
The Health Equity Collective was established in 2021 and since then has enabled more open discussion about the role of race in health disparities. The Health Equity Lunch offered another venue for important discussions that centered around the significance of representation.
It's really good to see the diverse, response of the audience. We have medical students, we have pharmaceutical, person, social worker, pediatricians and adults all bringing together, and this doesn't only extend to myeloma patients, it extends to all patients, underserved. Many institutions don't have that social worker or nurse navigator or a nurse that will help patients to help with medications, especially with the oral medications that we have now. As you saw in the case, lenalidomide was initially wanted to be added, but because the copay was very high. And if you had a social worker, we can apply for grant because there are resources out there to help patients whose copay, and we see that across the spectrum, that copay can be very high. And we have in more and more oral, chemotherapy, that we are going to have more high copays. And so having someone, a social worker, a nurse navigator, to help patients with grants, and we, in many centers have it, but there are some centers that don't, and this is a big issue, and we have to address that.